I'm Paul Pearson, host of Star Time, and when I'm not deep frying a turducken in a closed garage, I'm listening to Rainier Avenue Radio World.
How would COVID vaccines work in your body? Here are 3 things to know. Number 1, a vaccine is basically a training session for the immune system. Vaccines teach the immune system to look for the key features of a virus. So when a virus does show up, it's ready to fight it off. Number 2, a vaccine gives your body a plan to recognize the virus. Then your immune system starts preparing by making antibodies, or fighter cells, that stay in your blood as protection in case the virus tries to invade. What this means is you get immunity against the disease without having to get sick first. Number 3, when enough people's bodies know how to fight off a virus, it has nowhere to go. That slows the spread. When people get a vaccine, we're able to stop the spread quicker and get closer to ending the pandemic. To learn more, go to covidvaccinewa.org. A message from the state of Washington.
Hello, listener. What's important to you about what's going on in your community? Are you interested? Are you concerned? In any case, I invite you to tune into my show, Seattle Here and Now, on Rainier Avenue Radio World. Why? I will be covering a wide range of topics important to you and impacting the community. Each show will have a special guest or guests to share with you information on a variety of subjects that are happening here and now in Seattle. I promise I will work hard to make my show informative, interesting, and entertaining. Be sure to listen to Seattle Here and Now on Rainier Avenue Radio World.
This is your Rainier Avenue Radio World community update on the new City of Seattle Community Resource Hub, a one-stop online shop for city resources and information. Supported by the Seattle Department of Neighborhoods, the Community Resource Hub can be found at seattle.gov/resource hub. It's an online portal of city resources, information, and tools to help community members connect and engage with city government and with each other. That is seattle.gov/resource hub.
Yo, what's good? It's D-Money, and you should definitely check out Fresh Juice every Wednesday, 9 to 11 Pacific, right on Rainier Avenue Radio.
With pint-sized Patron, P-Treasy the Don. Y'all be sure to clean your mirrors as we play brand new hip-hop and R&B from locals and worldwide.
It's ID Yourself, a.k.a. Malcolm Flex. Make sure you check out Fresh Juice every Wednesday, Pacific Standard Time from 9 to 11 p.m.
And to get those exclusive interviews that we be doing.
Sipping a brand new Fresh Juice every single week.
Yeah, every Wednesday, 9 to 11, Rainier Avenue Radio. Yeah.
Do you want to reach out to the Vietnamese community in Seattle? Just advertise in Người Việt Tây Bắc, that is Northwest Vietnamese News, the longest running Vietnamese language newspaper in our region. Go to nvnorthwest.com.
This is Rainier Avenue Radio .world.
Rainier Avenue Radio, you are tuned in live to your community radio station, and we should be going live shortly to Public Health Seattle and King County's press briefing on the current state of coronavirus, featuring Dr. Jeff Duchin of Public Health Seattle and King County, and UW Medical's own officer of post-COVID clinic at Harborview, Dr. Jana Friedley. So that'll be starting shortly. We still haven't gotten the start of their broadcast yet. So as soon as they begin, we'll begin. So until then, enjoy yourself. Tell a friend to join in, and we should be starting here shortly for our live briefing here on Public Health Seattle and King County. And if you're tuning in for Seattle Sports Weekly right now, unfortunately we had to preempt their program. Masvita and the crew will be back next week, same time as always, Thursday at noon. But for now, we're going to hold things down until things start for the Public Health Seattle and King County press briefing.
Recording in progress.
Great. Good afternoon, everyone. My name is Sharon Rogan, and I'm with Communications here at Public Health Seattle and King County. We're so glad you all are here to join us for an update on COVID or epidemiology, and also for a special focus on long COVID. So without further ado, I will introduce Dr. Jeff Duchin, as well as Dr. Friedley from UW Medicine, who is joining us today.
Thanks, Sharon, and thank you everyone who's joined today. I am grateful to Dr. Jenna Friedley for joining us. She's a professor in medicine and executive director of the University of Washington's post-COVID Rehab and Recovery Clinic, and she's going to discuss the impacts of long COVID in our community and some resources that are available to people who are suffering from this chronic disease. Long COVID or post-COVID conditions include a wide variety of ongoing health problems after COVID-19. These conditions can last weeks, months, or years, and they can cause a substantial burden of illness that prevents people from working and doing their usual activities. Long COVID is estimated by the US Government Accountability Office to potentially affect up to 23 million people in the US. But before we get into long COVID, I want to provide a brief update on where we're at with the outbreak locally. I think everyone's aware by now that we're experiencing a sustained high level of COVID-19 transmission that has been increasing since April. We're currently seeing more cases per day than we did during the peak of the Delta surge. And we know that these numbers are a major undercount, as many people are using rapid at-home tests, most of which are not included in the official statistics. We're seeing these high case rates throughout the county and across all age groups. Our hospitalizations have increased threefold since April, and over the past week, we've seen 21 new COVID-19 hospitalizations per day, which is about one person hospitalized each hour around the clock. For the past 2 months, we're seeing a sustained level of hospitalizations for COVID-19 that is greater than what we typically see during the peak of an annual influenza season. Now, thanks to the effectiveness of our vaccines and booster doses, COVID-19 deaths are not rising at the same rate as cases and hospitalizations. And in fact, due to our vaccination level, COVID-19 hospitalizations are not rising as rapidly as they have in the past either. Nonetheless, 3 King County residents die each day from COVID-19, and that's up from 1 per day in April. But so far, this has held steady for about a month. Now, for a number of reasons, our regional healthcare system is under extreme stress right now, especially our hospitals. In addition to COVID-19 hospitalizations, our hospitals are seeing more patients whose surgeries or care were delayed due to COVID-19, on top of the seasonal summertime increase that they see in traumatic injuries and other conditions. A major stressor is that the hospitals are needing to continue to house and care for patients who no longer need to be hospitalized and are ready for discharge, but don't have an appropriate place to be sent in the community due to limited capacity in nursing homes, making those hospital beds unavailable for others who need them. You can help reduce the stress in our hospitals by not visiting the emergency department if you don't have a true medical emergency. Hospitals are reporting to us that they're seeing patients who are not able to get appointments with their primary care providers show up in emergency departments, but who don't have life-threatening conditions. If you can't wait for a primary care appointment, these conditions are better treated in urgent care facilities or using telehealth services. And if you do need to visit the hospital or the emergency department, please expect a little bit of delay compared to what you're used to. Please be patient with the care teams and expect longer than normal waits. A few words about the variant situation. Much of the reason for our COVID surge currently is the unexpected rapid evolution of highly infectious COVID variants, one after the next. The CDC estimates that the new BA.5 and to a lesser degree BA.4 variants are causing between 65 and 90% of infections in Alaska, Idaho, Oregon, and Washington. And that's as of a few weeks ago. The recent BA.5 variant is better at dodging our immunity from both vaccination and from past infection. And this means it's very easy for people who previously had COVID to get sick again. However, our vaccines are still providing great protection against hospitalization and death, but the boosters are needed to provide the best protection, especially for older adults. The variant is also good at infecting people who have already been vaccinated. And as I said, vaccination provides great protection against serious outcomes, but not necessarily against infection. It's also important to know that vaccination provides additional protection, even for people who've been previously infected. Now, I've remarked on this great accomplishment in the past. 82% of King County residents have completed their primary vaccination series, and that is wonderful. I would love to see the other 18% vaccinated. It's important to know that even if you've been infected in the past or have not completed your vaccination series or booster doses, the risk for reinfection is substantial with the new variants, and it's reduced by vaccination. The most important piece of advice I can give you to keep you safer from COVID-19 is to be vaccinated and get your booster doses when you are eligible, especially for older adults and those with underlying risk conditions. If there's a new vaccine formulation available in the fall to cover new variants, getting your booster dose now should not prevent you from getting this new formulation later in the fall. And again, while King County residents have some of the best vaccination rates in the nation, our booster rates are lower than they should be. For example, 30% of adults between 50 and 64 years of age have not received their first booster dose. Thankfully, 90% of those 65 and older have received at least one booster dose, and 10% have not. That's still a significant room for improvement. And for people under 35, less than one half have received the recommended booster dose. And we also know that our Black and Hispanic Latinx community members are less likely to have received a booster dose compared with other racial and ethnic groups in the county. And again, these numbers are for any booster dose, primarily the first, and we should have data on second booster dose completion available to share with you shortly, but it's likely to be even lower than that for the first booster. So again, really important message here. In order to get the full protection from COVID-19 vaccine, it's vital that you stay up to date with the recommended number of booster doses. So I'm going to say a few more remarks and then pause before we go to Dr. Friedli and the discussion of long COVID. COVID community transmission right now is very high. Hospitalizations are gradually increasing as the more infectious BA.5 variant is spreading. And to reduce this impact of BA.5 and future variants on individuals and our community, when transmission is high like this, we need to use multiple layered COVID-19 prevention strategies. I'm also concerned about the additional burden of COVID-19 illnesses and hospitalizations on our already stressed healthcare system and hospitals as we enter the fall and the winter, when influenza and other respiratory viruses are likely to circulate in higher levels than they have in recent years. So given high transmission and increasing hospitalization levels, I want to remind everyone to please take COVID-19 prevention measures seriously. As you'll hear from Dr. Friedli, even mild infections are worth preventing because each infection brings new risk for long COVID and other health problems. The COVID-19 pandemic, with the rapid evolution of new variants, is challenging us in ways we did not anticipate, and it requires long-term, sustained prevention strategies. We can minimize the impact on individuals and communities without going back to 2020 type restrictions. Relatively simple prevention measures can make a big difference. It's critical to understand that complacency is not the cure. Get vaccinated and boosted. The number one thing you can do to protect yourself from severe COVID-19 hospitalization and long COVID is to be vaccinated and up to date on booster doses. Pay attention to ventilation and improving indoor air quality. Outdoors is much safer than indoors, but when indoors, you can open windows and take measures to improve ventilation and filtration. There's lots of guidance about how to retrofit businesses and schools to improve ventilation, and we'll insert some resources in the chat for you. Wear a well-fitting and high-quality N95 or KN95 mask indoors in public spaces. And when possible, avoid crowded indoor public spaces. Get tested and stay home if you're sick or test positive and before gathering with high-risk people. And for people who are 50 years of age and older or who have underlying health conditions, COVID treatments are available if you test positive. Have a plan with your healthcare provider on how to be treated quickly. And if you're immunocompromised, ask your healthcare provider about Evusheld antibody preventive treatment, which is available in multiple King County locations. We can also put that information in the chat for you. Now, transitioning to the topic of the day, long COVID. CDC defines long COVID as new, returning, or ongoing health problems 4 weeks or more following initial COVID infection. Long COVID can last anywhere from a few weeks beyond initial infection to months and even years. Long COVID is more likely in people who've had severe COVID, but anyone who's been infected can experience long COVID, even those who've had mild illness or no symptoms. The data suggests that vaccination lowers, but doesn't eliminate the risk of long COVID. And the variant that you're infected with may also impact the likelihood of long COVID. As new variants emerge, the risk of variants that cause long COVID may change. So at this time, there's more we don't know about long COVID than we do, but it's clear that long COVID is common enough and can be serious enough that it makes sense to take whatever steps we can to decrease our risk for getting infected or reinfected with COVID-19. Many experts estimate that between 10 and 30% of people infected with COVID go on to develop long COVID of variable duration or severity. But even if long COVID affects only 1 to 10% of all COVID cases, based on a conservative estimate of the number of infections in King County, long COVID is impacting tens to hundreds of thousands of King County residents already. Many hospitals have developed long COVID clinics, and today, again, we're lucky to be joined by Dr. Jana Friedli, who's the Executive Director of UW's Post-COVID Rehabilitation and Recovery Clinic, and she will tell us more about long COVID, what's being done about it at the University of Washington, share some patient experiences, her own experiences, and resources for you. So Dr. Friedli, thank you again for joining us, and I'm going to turn it back to our moderator to make this transition.
Thank you so much, Dr. Duchin. And let's go ahead right to you, Dr. Friedli, and then we can take some questions.
Great. Thank you so much for having me here to talk about long COVID. I'm thrilled to be here to have this opportunity to share some of what we have seen here at the UW Medicine Rehab and Recovery Clinic for post-COVID conditions. We started this clinic over 2 years ago now, and started really initially seeing just the people who were hospitalized with COVID and helping with their recovery. And then very quickly realized that there was this whole population of people that are getting long COVID symptoms, even after very mild infections, and sometimes infections that where their initial symptoms are only for a few days. But then they start having additional long-term symptoms that can be really quite debilitating. I just as way of background, I myself had COVID initially in April of 2020, so very early in the pandemic, and I had symptoms for about 9 months after COVID, and it was very confusing to me. I was previously healthy. It was very unexpected to have these kinds of symptoms. So I know firsthand how incredibly distressing it can be and challenging. I think there's a few key points that I want to make about long COVID. So one is that the symptoms are extremely variable. So we see up to 200 different symptoms that are associated with long COVID, and we're oftentimes seeing a worsening of underlying conditions as well that are associated with recovery from COVID. So the way I like to think about COVID is that COVID is like lighter fluid. It just sets everything on fire. So anything that you had before COVID may get worse after having a COVID infection. And if you have a predisposition to a condition, COVID may put you over the edge, and you can develop new symptoms. So really, as Dr. Duchin pointed out, the most important thing is to prevent infection in the first place as best we can with masking and with vaccinations and boosters. I myself just got my second booster. I became eligible recently and just got my second booster yesterday. So I'm very excited about that. I think that's probably the most important thing to know about long COVID prevention is to get vaccinated. We are starting to see a lot of research about what the risk factors are for developing long COVID, but the number one risk factor for getting long COVID is getting COVID itself. So anything that you can do to prevent getting COVID in the first place is really where you should start. The other sort of key points about people ask me a lot about treatment and what we're doing for treatment for long COVID. I want to stress that there currently is not one specific treatment that uniformly works for every patient. So it really does take an individualized approach, and it takes a holistic approach. We assess people and all of the symptoms that they're experiencing, all of their underlying conditions, how it's affecting their life, and come up with treatment strategies that are really unique for that individual person. There's a lot of research going on treatments. So I do have a lot of hope that there's going to be more specific treatments for long COVID in the near future. Here at the University of Washington and through Fred Hutch, there are ongoing studies and clinical trials that are going on of medications for long COVID. But currently there's not one specific treatment that is uniformly effective for people. We do, though, however, have a lot of tools that we know are effective in managing people's symptoms. So just because there isn't one particular treatment, we've had a lot of success in getting people to feel better and to have their symptoms resolved. But it does take some time, and it takes, like I said, that individualized approach. So people ask me a lot about experimental treatments and things that may be effective. I always caution people that if you are going to try new treatments for long COVID, the best and safest way to do that is in the context of a clinical trial. So I really encourage people to participate in research if at all possible. People ask me also what types of patients that we're seeing in the clinic here. We have seen thousands of patients now at UW with long COVID, and I know we're just scratching the surface. We are seeing patients really from all walks of life and people of all ages. We're not only seeing adults, but we're also seeing teenagers and younger adults and people who were previously healthy, very high functioning. I have many doctors and nurses and respiratory therapists and professionals who have been very high functioning before their COVID diagnosis, who are really struggling with symptoms afterwards. So it is not specific to one particular patient population. The other thing I think it's important to recognize is that recovery takes a long time. That symptoms do get better over time, and that patients can have or that having symptoms even several months after COVID doesn't necessarily mean that you're not going to improve or resolve, or your symptoms resolve. So I think that there's a lot of hope. During that time, it's important to have a lot of support around you. So working with your primary care doctor, and also, acknowledging that the long COVID and the COVID pandemic in general has had an enormous toll on people's emotional health and well-being. And so making sure to address the impacts of long COVID on your emotional health are really important. There are a lot of great resources. The UW Clinic is one resource. There's a whole network of these clinics around the country through the American Academy of PM&R. There is a long COVID collaborative, and there's a great website that has a dashboard that has updates about the prevalence of long COVID. The other resource that I think is really helpful is the Washington State Hospital Association website, WSHA.org, has a great website that has a compilation of a lot of the resources that are available for patients, including some of the national support networks and systems. So I would encourage you to take a look at that website for additional information about long COVID. So I think I'll stop there and make sure that we have time for questions.
Great. Thank you so much, Dr. Friedli. And we'll put some of those resources in the chat. Appreciate you sharing those. And I know there's some questions coming from the community about long COVID, including some of the latest information about potential impact of reinfection. But what I'd like to do, because I know Dr. Duchin has a hard stop at 12:30, is I'm going to pivot to take a few questions for media that will be more specific to Dr. Duchin, and then ask folks to stay on the line. And I know we're getting some questions from media about long COVID. So with that, let me start with Meher Grua. You can go ahead and ask your question.
Hi, I just want to say thank you so much to Dr. Friedli and Dr. Duchin. This is Meher Graywall from Worth a Shot. So this question is for Dr. Duchin and Dr. Friedli. So now that people are being prescribed Paxlovid and molnupiravir, we often see a question as to whether they will prevent the incidence of long COVID. So are there any studies to indicate that taking these medications may be beneficial to prevent long COVID?
Well, Mayor, thank you for joining us in the question. Really great question about the research agenda. I'm sure Dr. Friedli can talk about the research agenda. I'm not aware of any such studies, and it's very early. I hope they're going to be done. I know there's a lot of organization happening across the country with respect to the research agenda. So I'm also curious to hear Dr. Friedli's answer to that question.
Yeah, I think it's a little bit early to see what the effect of those medications are, but as Dr. Duchin pointed out earlier, we know that your risk of long COVID goes up substantially the more severe your initial infection with COVID. So if you are hospitalized with COVID, it oftentimes can take 6 months, a year, or longer to start to recover from that. So anything and any strategy that will help to reduce the severity of the initial COVID infection is sure to impact the prevalence of long COVID symptoms and the recovery from COVID. So I expect that we'll see that those medications definitely have an effect, especially in the population that's high risk for the hospitalization and severe COVID.
And let me just add that this is a great opportunity to remind people that Paxlovid, the antiviral treatment for COVID-19 infection, is really important in preventing progression of disease if you're infected, hospitalization, and death. So it's great to know if you're eligible, and we can put information in the chat on who's eligible. But again, 50 years and older, underlying health conditions. If you test, as soon as possible after testing, taking Paxlovid can keep you out of the hospital and prevent really serious outcomes. So we want people to take advantage of this antiviral drug. And the first step is knowing if you're eligible, and then how you'll get that drug from your healthcare provider if you test positive, in a pretty quick time frame.
Thank you. Let's take a question from Elise Takahama.
Hi, Dr. Duchin and Dr. Friedli. Thank you so much for being here today. My question is for Dr. Duchin. right now. We've asked a lot about this in the past, but with your update today on the continued high level of disease in the community, even higher than last summer, you said, can you give any updates on discussions to potentially return to a county mask mandate or introduce any other public health interventions to kind of help keep this level of disease down?
Yeah, thanks, Elise. So as you know, the key interventions are vaccination, and we're doing fairly well on that, but we need to do better on boosters. Improving system-wide improvements, like improving indoor air quality in our public spaces, our businesses, our workplaces, and schools. And there's great guidance on how to do that. And then for personal protection, primarily wearing good quality masks in indoor public spaces. We are in active discussions about if and when to consider issuing a mask mandate. It's not an easy question because things change over time. For example, if we were seeing the level of severity of illness that we saw before people were as well vaccinated as they are now, or during the Delta surge, I think we would be moving more quickly to such measures as a mask mandate. Right now, we're taking into account, the unpredictable nature of the evolution of these variants, the relatively lesser impact on hospitalizations and deaths and severe outcomes. And I think importantly, the understanding that COVID-19 is not one and done. This is going to be a real long-term challenge for us. And over the long term, the best way for our community, locally and nationally, to fight it is going to be through voluntary measures. We're not going to be able to have infinite series of mandates forcing people to do this, that, and the other. They have the role where things get very serious and we need short-term immediate improvement. But over the long term, we really do need people to understand that we need both our business community, our leadership in the community, and our community members to take the steps that they need to take to protect themselves and one another. And so I would really love to see right now a reinvigoration of the enthusiasm that our community partners had early on in this epidemic to promote COVID-safe spaces, to promote the wearing of indoor masks. I mean, I went to a facility where I was so pleased to see this poster up, mask use encouraged. It's a rather large facility, and it had one small poster that said mask use encouraged. Simple things like putting up more signage, reminding people, making this a norm is going to be incredibly helpful because, again, this is going to be a long-term challenge. The challenge of acute illness has receded, but the challenge of long COVID and other complications will be with us, and it's going to serve all of our interests over the long haul to find solutions that are least onerous and most effective. So again, the bottom line is yes, we are actively considering if and when additional mandates may be needed. And I'm really encouraging everyone now to please, let's make sure we've done all we can on a voluntary basis before we have to go there.
Thank
And
you.
with that, I'm sorry, I need to jump off for an ACIP COVID-19 vaccine work group meeting. So I look forward to being able to spend more time with you the next time we do this, but goodbye for now.
Thank you, Dr. Duchin. And with the questions from media that you have for Dr. Duchin, we'll be sure to follow up with him and get your answers. But I know that we just were able to take a few questions, but I know we have questions still for Dr. Friedli. So let me start. Elise, I know you had a question for Dr. Friedli, so let me follow up with you on that, and you can go ahead and ask your question, then we'll get to some other folks as well.
Sure, thank you so much. Yeah, Dr. Friedli, so wondering also, as you're seeing the symptoms continue to vary for your patients, we're wondering if there are any dominant symptoms that you're seeing right now among these patients during the current COVID surge, specifically with BA.5, as Dr. Duchin said.
Yeah, that's a great question. And as we have over the last 2 years seen multiple different variants, we then, about 2 months after the surge are starting to see people who are having some of those persisting symptoms. So it's still a little bit early to see what this latest variant is going to bring us in terms of long COVID symptoms. But certainly each variant that comes about does seem to have a little bit of a different flavor, different sort of constellation of symptoms that people experience. But in general, most of the patients with long COVID are still experiencing the similar types of symptoms, the most common of which is fatigue and brain fog or cognitive impairment. And then we're seeing a lot of blood pressure and heart rate instability, people feeling lightheaded and having headaches, and then also experiencing sleep disturbance. So that's one of the most common symptoms that we've seen throughout this entire pandemic.
And a related question that has come in from the community, Dr. Friedli, what is your comment about the importance of rest after infection? Since so many long COVID sufferers, it appears are attesting to troubles beginning with exertion. So any thoughts on that?
Yeah, so that's another great question. And one of the symptoms that we see that comes along with fatigue is what we call post-exertional malaise or fatigue. And so we are seeing that when people overdo it, that tends to make their symptoms worse. And that's particularly true with exercise. So a lot of people can't tolerate that higher intensity exercise that they were used to doing before COVID without triggering some of their symptoms. And from my own experience and from the experience of my patients, I can say that you really can't push through the recovery from COVID. You have to let it takes time to recover, and you have to take that time to rest and recover. And pushing through it in the early phases of recovery oftentimes sets the recovery back and makes symptoms worse. So we tend to tell people to rest, take the time that you need to recover from COVID. And then as you start to increase your activities, do it very slowly and consistently. Make sure to pace yourself and try to avoid some of the high intensity aerobic exercise, heavy weightlifting if you get back into exercise, and just be cautious that some of those activities may trigger some of your symptoms. So definitely pacing and going a little bit slower and taking time to recover is important.
Thank you. Kate Walters, did you have a question for Dr. Friedli?
Yeah, thank you so much for taking the time. I appreciate it. I was going to ask this of Dr. Duchin, but I'd be very curious to hear your thoughts on it. I'm wondering what role you think public health should be playing in the long COVID landscape. You know, it's sort of one of those things where had a very public health heavy involvement in the COVID-19 response. As we move on to living with COVID-19 and more people dealing with long COVID, what do you envisage that looking like when it comes to sort of, places like UW versus public health versus private practice?
Yeah, so I think for me the sort of biggest takeaway and something that we've unfortunately learned over time is that long COVID is a long-term public health issue. So we need to approach it in that way. And it's clear that when you look at the national dashboard, and as Dr. Duchin mentioned, there's at least estimated to be at least 23 to 26 million Americans who are affected by long COVID. So with that, we clearly need to have a national plan for addressing long COVID. We now have many more of these multidisciplinary clinics that are available throughout the United States, like the one that we have here at UW, but it's not enough. It's not nearly enough to be able to see all of the patients who are affected with long COVID. So we need more national resources to fund these clinics to help us to be able to grow and to see more patients in these clinics and to provide more education to primary care physicians and education to the public at large. I think even though there's more attention nationally to long COVID, there's still a lot of work that we need to do to educate people about long COVID and what the impact is. And I do see that people are tired of COVID and oftentimes are forgetting that there is not just the acute infection that you have to worry about, but some of these longer term sequelae. So I absolutely think it's going to take a national coordinated effort in order to manage the effects of long COVID. The other important takeaway, I think, also is that this is really affecting people's ability to go back to work and to work effectively. And so it is affecting our workforce, not only acute infections affecting people's ability to go to work in the short term, but people's ability to go back to work as they're recovering and or experiencing long COVID. And there's a lot that we can do to support people as they're going back to work in order to get them back to work earlier and more effectively. But that's going to require a lot of coordination with employers and education with employers to understand how long COVID affects people, and understanding that people do need the time to recover, that relapses in symptoms are very common. That working and stress and pushing too hard are the most common triggers for these relapses. And so, figuring out ways to make work accommodations to adjust hours and give frequent breaks and change the environment around the worker to support recovery is really important. So there's many things that we can do, but it's going to take a coordinated effect.
Thank you so much, Dr. Friedli. And I think I would add also, just from the public health systems piece, I know we have a resource, public health systems were resourced to address some of the very acute needs, but there needs to be so much additional support for the longer term impacts. And public health is responsible for chronic disease types of impacts. And so there is, some structure and history around that, but being able to have the funding and resources and coordination around that will take a much broader effort. And I would also just add that one of the roles of public health is to look at addressing some of the inequities in access to services. And I'm not sure, Dr. Friedli, if you're seeing any disproportionate differences around who's able to access care. But I think one of the things that the public health system really needs to grapple with and continue to work on is the disproportionate impacts that COVID has had on certain communities, lower income communities and communities of color, and being able to close any gaps in access to care, particularly for long COVID. So I would imagine that's an area that public health would take a broader role in over time.
Yeah, I think that's absolutely true. And that's a great point to bring up, that we are seeing that COVID disproportionately affects people of color and people in low income communities. And we also know that those are the people who are least likely to be able to access services for long COVID. And that's certainly what we are seeing. So there's a lot of work that needs to be done to increase access and outreach into the community to make sure that people have services for long COVID.
Thank you. Nicole Jennings, you can go ahead.
Hi, this is for Cairo News Radio. What I'm wondering is adults who are under 50 who are not immunocompromised still cannot get the second booster. What is your recommendation as we're seeing these case rates and hospitalizations that are high and these new variants circulating that are incredibly transmissible? Should we be going and trying to get that second booster? Or, what else can we really do, and how much longer are we going to have to wait?
Yeah, thank you. We can pass your question on to Dr. Duchin, but what we know right now is there is discussions going on about the expansion of boosters and booster eligibility. And I think, we're starting to see even more conversations about that. So I would say that we wouldn't be surprised if the eligibility starts to shift. We know the process of that. It goes through FDA and then CDC and then advisory committees to really look at the data around boosters. But I would say that those discussions, as far as what we've heard, are in the works about broadening the age range for boosters. And I think what we've seen, particularly in the data, is we still have a large proportion of the eligible residents that still need to get their boosters. And we know that as more people are boosted, then we reduce the risk for the entire community. And so that's really a good way and an important effort that we're taking to make sure that those who are eligible for boosters have access now and are able to do it. And I think one of the key messages Dr. Duchin said, and I see this question in the Facebook chat, is whether people should wait till the fall to get their boosters if they're eligible. And the answer is no, that now is a really good time to get the booster, particularly with the amount of virus that's circulating now. And that if new formulations came out, which I know we hear quite a bit about, that folks would still be able to get that booster in the fall. So to address your question as well, Nicole, the prevention messages that Dr. Duchin shared at the end that we know can make such a big difference, from masking to really improving ventilation, opening doors and windows, looking at reducing risk with testing before events and after events, and making sure we're doing all of the public health measures now can make a really big difference. See, I'm looking here to see if there are other questions from our media folks here. Let me ask, I'll just see if there was any other long COVID questions for you, Dr. Friedli. I'm just looking here. We had the question about rest, which I think was a really good one. And anything that you're seeing just in differences, and I know probably the research is quite early here for, if you're seeing any differences based on folks who've been exposed a little bit later, potentially to the BA.5 variant, and any differences you're seeing versus those that may have been exposed earlier on in the pandemic to Delta or other variants.
Yeah, I would just say that we're continuing to see long COVID, even with the more recent variants. It's still a little bit too early to know what the effect of the most recent variants are going to be, because there is a delay by definition. Really, long COVID is only defined after 2 to 3 months after your initial infection. So it takes a little bit of time for us to see what the impact of a new variant is going to have on those persisting symptoms. But we are continuing to see, with every variant, we are continuing to see around the same rates of long COVID that we saw with earlier variants. But I do think that the severity and the incidence goes down with more people being vaccinated and boosted again.
Well, thank you. And before we wrap up, I just wanted to double check with folks if there were other questions. Happy to take a couple questions too about monkeypox, not related to COVID, but happy to take a few questions on that if helpful for anybody. Great. Well, we appreciate your expertise, Dr. Friedli, and all that you're providing to the community as far as providing access to treatment and information, and appreciate you being here. And with that, I hope everybody has a great afternoon. If we didn't get your questions for Dr. Duchin, again, feel free to send it to us, and we will get our answers back to you as soon as possible. With that, have a great afternoon, everyone.
Bye-bye.